Hello, this is Dr. Siddharth Tambar here at Chicago Arthritis and Regenerative Medicine. I'm here with our star physician assistant, Miss Leah Brown, and we are talking about peptide therapy for weight loss. Peptides are molecules in your own body that help to run different functions, and a newer treatment are peptide therapies that we're utilizing for weight loss themselves. So Leah, we are talking about Semaglutide and Tirzepatide. Can you please tell us a little bit about what these treatments are and how they work?
Semaglutide and Tirzepatide are GLP-1. They're peptides basically that act on the brain and the GI system to kind of help you feel full, help you slow more digest your food, and basically control your appetite.
So I've heard a lot about Ozempic. Is semaglutide the same thing as Ozempic?
Yes.
So who's an appropriate candidate for semaglutide?
For anybody who has a BMI of 27 and over, anybody who has a BMI of 27 and has other health issues such as hypertension, high cholesterol, heart diseases, or anybody who has a BMI of over 30.
I think also for BMI over 27, if they also have osteoarthritis, so that would include knee pain, back pain, that can be a candidate as well. What's interesting about these newer class of treatments is that they're showing to help out not only with diabetes, with weight loss, they're even helping people with things like knee arthritis as well. Can you please tell us how do these treatments compare to some of the older weight loss treatments that have been around?
I think these treatments are a little more effective than some of the older things that have been around.
Well, are they safer?
Yeah, safer.
And are they more effective?
Yes, I believe they are more effective.
So on average, what would be a expected percent weight loss for some mistakes?
You lose 15 to 20% of your weight within a year on these treatments.
And is that fairly reliable?
Yeah, these treatments actually compared to some of the older methods are good. It comes from sustained weight loss.
And then tell me about what is the treatment process? So let's say somebody comes to us and says, hey, I'm interested in semaglutide for weight loss. How do we handle that? How do we sort of figure out if they're a right candidate, and how does that proceed?
Well, we first talk to them about the things that they've tried already for weight loss, kind of what their journey has been like. And if they struggle with losing weight, and especially if they have comorbidities like the high blood pressure, osteoarthritis, autoimmune inflammatory diseases, then they would be a candidate.
So tell me how treatment works. Is it how often are they being treated? How often are they being monitored, managed? How does all that work?
Well, they would take the GLP-1 once a week. We would follow up with them every 4 weeks to monitor any kind of side effects. I'll talk about how much weight loss they've been experiencing, if they're experiencing adequate appetite control, and then we could adjust the dose based on how things go.
How quickly should somebody expect to see results?
You should expect to notice some weight loss in that first 4 weeks of taking it, of being on the GLP-1. You should notice maybe about up to, I'd say, 3-4 pounds of weight loss in that first 4 weeks.
Interesting. And is there a progressively escalating dosage?
Yes. It depends on how you're tolerating it and how much weight loss you've had.
And what about diet and exercise? Is there a role of diet and exercise with these treatments as well? Or is this on its own?
You should definitely be doing diet and exercise. This is going to help you more with the appetite control and the food part of things, but if you really want to get good results, you need to also be exercising regularly.
So I think when these treatments first came out, you heard a lot about for diabetes, and then you started hearing about actors and actresses using it for weight loss. Is this an appropriate treatment for the average American, the average person who's trying to lose a little bit of weight?
I think it is, yes.
Okay. How would you guide someone to decide whether they should jump into this kind of treatment or not?
I guess I would ask, what their usual routine as far as diet and exercise are. And just get a history of what their weight loss journey had been up to this point, and how successful their unsuccessful it's been.
So 15 to 20% on average weight loss sounds pretty good. How long is someone going to be taking treatment for? Meaning, will someone be on this long term?
It's a long term.
Is it safe to take long term?
Yeah, it's long term, and I think it's safe to take long term as well.
What are the potential side effects? There's nothing that has no side effects. Right? What are the potential side effects?
Any side effects that with these types of peptides are associated with the GI system.
And let's say it's holiday season, as it is right now while we're taking this. And you said that this sort of helps to reduce the thoughts about food or hunger, that sort of food chatter. How would you handle that period of time around the holidays where people are having dinners with family and all that? How can somebody still enjoy that part of their life and still continue this kind of treatment?
You are going to have some appetite suppression, of course, with these drugs. If you want to enjoy your holidays, such as Thanksgiving, and you eat with your family, what I would do is actually you could skip a week dose. Take it every week, but it's in your system for 2 weeks. So maybe skip that week, enjoy your holiday, but then get back onto the routine after that. However, you do have to be cautious that because it's still in your system, you don't want to overeat. Enjoy your food, enjoy the time with your family and the desserts and things, but don't overeat or consume too much alcohol because you can still get some GI upset on this drug if you overeat.
So if you're Chicago Arthritis, you're our resident expert when it comes to peptides for weight loss. What's been your experience in patients? Are people happy with their treatment? What's been your overall professional experience with these treatments?
I think people have been pretty happy with it. I think it's not just because they're losing weight, but I think like they're having more confidence. They're feeling better in their clothes. They're feeling better during their workouts. They just overall, I think it just kind of it definitely improves your attitude and trying to give you a new lease on life. When you feel good about yourself.
That's fantastic. Well, thank you very much, Leah, for your time. I think for anyone who's interested in peptides for weight loss or other health issues, you can contact us at chicagoarthritis.com, and we're here to help.